Well, Nicole, we're so glad to have you on tonight. And I'm just going to do a quick introduction real fast. So Nicole Stroop, nurse practitioner, you deal in functional medicine, and our podcast platform is really about men's mental health awareness, but we wanted to kind of tie in not only the physical and the emotional and the spiritual health, but bring in kind of the overall wellness piece. And I know historically men are less likely to go and see their doctor and have lab work done. They kind of put things off when it comes to routine checks and physicals. So love to kind of pick your brain tonight, kind of hear, your story, a little bit about your background, where you're from, and then obviously the importance of the functional medicine side for men's health.
Absolutely. Well, thank you so much for having me. This is so fun. I'm so excited. Feel very lucky to be a part of y'all's podcast journey. But yeah, like you said, I'm a functional medicine nurse practitioner. I have lived here in Nashville pretty much my whole life. I also went to school here. I went to UT Knoxville for my undergrad and then Belmont for my master's as a family nurse practitioner. And then I went to the Institute of Functional Medicine for my functional medicine training. I've done several certifications along the way through the American Academy for Anti-Aging Medicine as well. And so I really love what I do. I feel like I am able to give people their lives back. And I think you touched on it so well in the beginning. Men are notorious for not seeking healthcare when they need it. And I know if, with my husband, if it wasn't for me being like, we have to do this, he probably wouldn't do much of anything at all. So men are definitely notorious for that, but it is so important to make sure that we are keeping up with our health as we age, especially for men. Like when you look at that testosterone component, I feel like men as they age, they get so many symptoms and they're just like, well, I'm getting old, so this is just aging now. I'm just going to feel this way, but it doesn't have to be that way. And I feel like there's a stigma around men seeking healthcare and men also getting your hormones checked. What's going on there? There's a stigma around testosterone and a stigma around taking care of your health. And I think it sometimes historically has had a bad rap. When you think about testosterone, a lot of people sometimes immediately jump to oh, if I'm not bodybuilding or I'm not in the gym, I don't need it. But that's definitely not the case. It is so cardioprotective and brain protective. It is such an important component of aging.
Awesome. Yeah, it's definitely still kind of a taboo subject, I think, in our society with testosterone. Kind of like you said, to your point, you have to be a bodybuilder or an extreme weightlifter to use it. And it seems like without me getting on a soapbox, weed is okay, but if you take testosterone, then you're a horrible person. And I don't understand that, but it drives me nuts. But I think hopefully you shedding some light and providing some further education, maybe you'll get some of those guys that are out there on the fence about their wellness, or maybe looking at their hormones, having them tested to kind of, hey, it's not really a scary thing or a taboo thing. You're not a weak individual. If you go to the doctor, you're trying to tough it out and kind of provide some more insight on that.
Yeah, Nicole, one of the things I think is interesting, maybe you can help lean into it a little bit, is what do you hear from your besides?
Sorry, guys. I'm sorry. Yes. Y'all, he never barks unless I'm doing something. He knows I'm doing something, so he's yes, I'm gonna bark nonstop now. I'm so sorry.
He needs to understand why he's not a part of it.
Yeah.
Yes, pretty much.
What do you hear when folks come to you, men in particular? What are they saying when you talk about hormone health? When you talk about total body? What's their initial feedback to you?
Yeah, so most common complaints I get from men are, as we age, joint aches and pains, stubborn midsection abdominal weight gain. They're going to the gym, they're eating as they always have, but results are no longer being produced. In fact, oftentimes I hear that they feel like they're almost going backwards. Low libido is huge. Aside from that, brain fog and fatigue. So those are the things that I definitely hear the most. Those are all the red flags of, oof, this person probably has testosterone deficiency. And truthfully, we're seeing it at much, much younger ages than I think men even recognize. I would say majority of my men, and this is so sad, this isn't how it's supposed to be. This is just a repercussion of the society that we live in. But men in their 20s are typically when I'm really starting to see testosterone decline, or even early 30s, which is not how it should be. Historically, we used to see this like when you enter your 50s roughly. But now it's much, much younger than that. And so I feel like, especially in my generation, you know, people who are younger than me in their 20s or in their 30s, they're like, you know, this can't possibly be testosterone. I am way too young for that. But that's not the case at all. In fact, we see it tied in hand with things like insulin resistance and cardiovascular disease. And so oftentimes people don't even recognize that the stuff that we're putting in our body, the exposures that we're getting every day, and genetics do play a role too, are all accumulating this really kind of negative outcome in our body where testosterone for men and women alike is being depleted at a much younger age.
Does stress have a factor in that? I feel like stress is like now more than ever, probably. I don't think we realize we created all this technology to like help us be more productive, but it's made us all have to be production machines, basically. Do you see that?
Yeah. Oh, yeah. I couldn't agree more. Stress is so important. I think people oftentimes forget that every single one of our hormones is related to each other. So if one of them is not working, odds are a lot of them aren't working. Stress, being our cortisol hormone, is huge in our ability to even produce sex hormones. We can have different mechanisms happen in our body that when we're stressed, it literally causes us to put on weight. It literally causes our hormones to stop working. It stops so many functionalities in our body that are so crucial for health. And I think you nailed it. We very much live in like a technology-driven society, and just a stressful society. Like here in America, we all live at a very high-paced, like fast-paced, high-stress life. And that's like normal now. And it stinks because there are so many repercussions of that as a society, we haven't really talked about very much.
Could you see almost in a way managing hormones, especially testosterone, would that be considered almost a way to maybe, and I know this is probably more of a pharmacology question as far as psychology goes, but almost a way to manage like depression or anxiety through making sure that your hormone levels are up to par? And if you were adding in maybe testosterone, that could maybe keep someone from having that high stress or high anxiety and help them function in a normal way without maybe resorting to taking a antidepressant or anti-anxiety medication?
That's a good point.
Yeah, that's a great question. And I completely agree. I think it's multifaceted. So I think to touch back on like all of our hormones are related, testosterone does play a really big role in that and indirectly influences like our actual neurotransmitters. But on the other side of that, I think, you know, as we age, and things change, things don't work as well. We don't feel as motivated, especially when you gain weight. The performance isn't there, especially men, you know, they're kind of like stereotypically that leader of the household. So when they start to feel like they just don't feel like themselves, like they're just kind of dwindling, I think that plays a huge role in the development of depression amongst men, as well as anxiety, feeling like you can't perform the way that you used to, both like in your relationships, but also on a professional level. So for testosterone in that, I think that's very, very important to keep in mind.
Okay, awesome. Good to know.
So I know we talked a little bit about it, or touched on it, you touched on it, the things we put in our bodies. So one of the things that I've talked to several guys about that maybe are entering into some hormone treatments, but they're not changing anything, diet, lifestyle, anything like that. I mean, does this, you said one thing impacts another. Can you kind of dive into that about, especially when it comes to diet and exercise?
Yeah, absolutely. So it's interesting. There's a study out there, and who did the study is escaping me, but we would think that aging is the most common cause of testosterone deficiency, but that's actually not the case. Aging is at like the very, very bottom of the list. Some of the like top 5 causes for testosterone deficiency revolve around things like insulin resistance and chronic use of pain medication. And so diving a little bit more into insulin resistance specifically, When we talk about what we put in our body and our body's ability to perform and produce hormones adequately, having insulin resistance stops that from happening. And when you look at it on a cellular level, the molecules that need to bind to our hormones to make them go get suppressed when we have insulin resistance. So you physically cannot use your hormones the same way when you have things like elevated fasting blood glucose. So that's that like carbs and sugars that float around in your bloodstream. Or if you're someone who has like a slightly higher hemoglobin A1C or chronic high cholesterol. We also see it in people who have history or active issues with things like cardiovascular disease. So a general rule of thumb that I love to recommend for my patients is to look into something like the Mediterranean diet. The Mediterranean diet is probably the most versatile, well-rounded diet that you can recommend to anyone across the board for its nutritional benefits. Doing things like making sure you get plenty of healthy omega-3s, things like extra virgin olive oil that's pure, or your fatty fish like salmon. Making sure that you're eating a nice, well-rounded, phytonutrient-dense diet, so you're getting lots of colorful food on your plate. Making sure that you're getting all the nutrients that are necessary to protect your body, make your hormones work, make them go, if you will. And outside of that, I think the other part of it is staying active. You know, just because you don't feel like being active or you don't feel like you have energy doesn't mean being active isn't important. And I don't necessarily mean like you have to go weightlift 5 days a week, but the intentional movement component of your body, even if it's just walking daily, is so much better than being sedentary. In the Institute of Functional Medicine, we joke a little bit that being sedentary is like one of the leading causes of disease, because just minimal movement, like 30 to 60 minutes, 3 to 5 times a week, is so much better than doing nothing at all, and can significantly reduce your risk for things like insulin resistance, which helps you so much in the long term of maintaining those adequate hormone levels.
So I have a quick question. Maybe you can clear this up for me. So I heard some scuttlebutt that green beans increased estrogen levels and lowered testosterone.
That's not true.
Can you shed some light on that?
I have a friend that I really love and care about, and he refuses to eat green beans. I don't know.
Because your friend doesn't like them. They're nasty.
It's you're the friend.
Yeah. So Chance owns a company called Peace Love Grub, and it's a meal delivery service. And so I get my food every week from Chance, and he loves to hide green beans in the meals. And so finally I just started ordering chicken and rice, or steak and rice, because I just push them around. I don't eat them. So,
is it like a texture thing?
I mean,
he's not autistic. He's just.
No, they're just, I mean, if he was in the kitchen and steamed some and said, hey, eat these, but you know how it is. It's been in the fridge a couple days and I nuke it, and I just don't like them. I used to drink green powder a lot. We've talked about this, but I kind of quit drinking it because of some stomach issues, so I don't eat enough vegetables. I need to, but the green beans, I just have to suck it up, I guess. But.
No, it is. It's funny because we do our performance meals are really geared towards guys and gals that are fitness related, trying to work on their bodies. And so many of them were doing just that. They were pushing their vegetables aside and eating the meat and the carbs. And so I started mixing up the vegetables in it, so you couldn't get around them. He figured out a way.
Yeah, I figured out a way. Throw them out. Just throw them out. It's wintertime, right? Dirty bulk.
Yes, as we discussed, I was like, you can bulk one of two ways. Totally up to you. It's clear we went the anti-green bean route, so that's fine.
Well, let's talk about that for just a little bit. So while we're on the topic of diets, and assuming I was on a similar journey, I got on TRT, immediately felt incredible, got back into the gym. I wanted to start putting on weight again. I started clean bulking, but maybe for the folks listening out there, can you kind of dive into that just high level on the difference and kind of what the effects of that is?
The effects of clean bulking, or like including
versus
vegetables?
Dirty, and
it is exactly almost as it sounds. When you're trying to put on mass, you can do it one of two ways. You can do it a clean way, which is the recommended way, Steve. I told him it was fine. But yeah, you can do it the clean way. Yeah. You know, the biggest thing is you just...
She's educated.
Yeah, she's educated.
Oh, that's hilarious. But yeah, you can do it the clean way. You can focus on lean proteins. You can focus on greens. You can focus on unrefined grains, things that are going to not give you like that glucose or insulin spike. All of those things in calorie excess will allow you to increase your muscle mass, especially when you're putting the work in the gym. The difference between that and a dirty bulk, of course, is kind of like a seafood diet. You seafood and you eat it. And it is just a free-for-all. Really, at the end of the day, the goal is the same between clean and dirty bulking. You want that calorie excess, but the difference is how much fat are you going to put on in the process. And so someone who's going to do a dirty bulk, the likelihood is you're going to put on a greater percentage of body fat while still gaining muscle mass than you would if you were to do a clean bulk, whereas you're not going to put on quite as much fat, but you will still gain that muscle. And personally, I mean, I think I live a very 80-20 lifestyle. So I'm very much like 80% of the time I am doing my best. 20% of the time I am just enjoying life and enjoying the world that we live in. And
That's
so
way
I
to
think
do it.
for people, yeah, I think so, because otherwise you just get like burnt out and you get burnt out on everything having to be clean and non-toxic and perfect. And that's just not really a way to live, in my opinion. In fact, I think that increases stress levels in a lot of people.
Yeah.
So
No doubt.
I don't know that I would recommend ever going like full dirty, but I'm like, there's always a mix for an in between.
Well, funny you say that, because per our conversation last week, without violating any HIPAA policies, my dirty bulks had to come to an end. So yeah, I had to switch gears a little bit, because it was causing some issues that I didn't see coming. And so not weight gain, but other things.
You know what's interesting is I clean bulk. I'm clean bulking right now. I'm 3,500 calories right now. But it's super clean, except for at the end of the day where I'll eat like Haagen-Dazs.
Well, that's not clean bulking then.
But it's at the end of the day.
It doesn't matter.
No, it's after the sun goes down, so it doesn't matter.
80-20.
Yeah, 80-20. That's
There
it.
you go.
80-20 and clean bulk don't go together.
Right. That's fair.
All or nothing.
We'll call it a murky bulk.
Murky bulk.
Yeah.
Yeah.
So I got to ask, Nicole, I got to ask you, because you didn't mention it in your bio. And we're talking about bulking, clean and dirty. We're talking about hormones. We're talking about weight training. Will you kind of go into your background when you were competing, just to kind of let our viewers, because I got to tell you this real fast. Like, I think it is so cool, not only to go to an educated, person when you're doing your hormones, but someone who's actually lived the life. Yeah. To me, it's almost like hiring a personal trainer that actually works out versus someone who just has the knowledge base and has never really put the effort into the gym. But so I want you to kind of shed some light on your competitive background.
Oh yeah. I guess I should have mentioned that in my bio, but
you should.
That's fair.
That's a big deal.
That's a big deal. Yes. And given like our conversation, I should have mentioned that, but yeah, I used to compete. So I used to do women's bodybuilding. I competed in the figure division. And then after I did women's bodybuilding, I did that for about 4 to 5 years. I competed about once a year. And then I moved on to women's powerlifting. I will say I never got to my first powerlifting meet because I had a very awful back injury, which is kind of what led me into orthopedics, like in medicine. But it was still a very, very exciting journey. I had quite a bit of success with it. I really enjoyed it, but it was most appropriate for me at that point in my life. Now where I'm at, I don't know that I could do the same dedication of lifestyle, because it is very, very dedicated, very, very grueling in terms of measuring everything and making sure you're in the gym. Like, there are no exceptions. There's no cutting the rules. But I mean, I loved it when I did it. It was a very eye-opening experience for me, because it helped me to recognize, especially when I have clients that are athletes like yourself, what you guys are putting in, like the amount of effort that goes into this. It really makes you recognize and understand and feel like gratitude towards people who are wanting to put in that amount of work to see that type of success.
Awesome.
Yeah.
Yeah. So I think the majority of the clients that I work with, and I think that Steve works with, these are not competitive athletes. These are folks that for the most part have never been physically fit or moderately physically fit. In your experience and the folks that you work with, I mean, do you see an uptick after starting treatments and their desire to be physically active? I mean, what's the mind frame that you're seeing?
Yeah, I think a little bit of hope, if you will, goes a long way. It's kind of like that when you're starting that diet, right? Like it's so daunting. Day one, you're like, oh my gosh, I have to lose 20 pounds. Like today is the day I can no longer eat, I don't know, cookies. Like everything in life is going to be so challenging. But then once you start to see that progress, like you look in the mirror and you see a little bit of definition, you look at the scale and you're like, okay, yeah, I'm seeing progress. I think once you start to see those little wins, you develop so much motivation that allows you to essentially continue that forward momentum and almost create bigger and better goals for yourself, maybe even goals that you thought were unattainable in the prior lifestyle that you were trying to adhere to.
That's awesome.
Yeah. Do you feel like you guys see the same thing?
Yeah, for the most part. I tell my clients don't even look at the scale. Like the scale doesn't.
Yeah, that's fair.
Like I don't think that's a fair.
Yeah.
I went to the doctor and it was a Zoom meeting, and they said, "Okay, what's your height?" I said 5'7". They said, "What's your weight?" 175. The doctor was like in New Jersey or something, and they said, "Oh, you're morbidly obese." And I said, "Oh, okay."
Gosh.
Yeah. Haagen-Dazs down.
Yeah, morbidly obese.
He's going on BMI.
Exactly. Like
which I cannot stand. No BMI.
It's just not
useless.
It's useless. For me, what I tell people is, how are you, number one, feeling? And then are you seeing anything in the mirror?
Yeah.
And if you're not, then let's focus on areas. Yeah. And you more so because you're.
The biggest thing I see, though, is energy levels. It's cool to see a client from day one. And my studio, you've got a view of the parking lot, so you see people walk in. It's only 1,000 square feet. But typically for the first couple of days, they're not all of them, but some of them are kind of unsure of themselves. They're nervous. But as they progress with the program, you just see them. They kind of pull their shoulders back, their heads up. They've got more confidence, and the more they come in, they're moving better. They seem like almost like a whole new person. And I focus more on the general fitness side of the house. So a lot of my clients are, over the age of 50. They want to, feel better. They want to move better, but they want to be able to play with their grandkids or do stuff on the weekends like, pickleball or something like that. And so they just feel, they see results, but it's also more of just a general wellness thing versus, hey, I'm repping out 5 more reps on a flat dumbbell press or something. Yeah. And they see the strength increase, but a lot of it is just their overall quality of life is improved through it, which is really cool to see. I love the confidence thing.
That's my favorite thing is the confidence.
Yeah, it's really cool.
Yeah, absolutely. I love to see that as well. And I completely agree with you. I have so many patients that have a very bittersweet relationship with the scale. And I'm like, if that's not what's best for you, then just ignore it, throw it away. Don't even look at it. I love the mentality of doing like, how are your clothes fitting? How do you feel about yourself when you look in the mirror? Like those are the changes that I prefer to see as well. So I love that you touched on that because I think the scale can be very bittersweet for a lot of people, especially in the field of putting on muscle. There's definitely, it doesn't always go like this. It's usually more like this. And that can be, that can be really, really overwhelming for a lot of people, especially when they're new on that journey.
Well, and you want it to be a positive experience too. And if they're worried about a number on the scale, it's
not positive.
It's easier just to quit and say, I give up. I can't do this.
Yeah.
So
yes, exactly. Exactly. Yeah.
Yeah. One of the things that strikes me is, especially again, working mostly with men, men have a lot of insecurities.
Oh, really?
Really?
You're right.
We hide them with things like humor or
testosterone and lifting weights hides our insecurities.
Just
kidding, Nicole. Just kidding. Yeah, tattoos for sure. Tattoos. More tattoos than the testosterone.
That's right.
Yeah, definitely.
But even something like getting hormone treatment is an insecurity for a lot of guys.
You think so?
Yeah, man. And I've talked to some guys and they were like really waffle on it. And they're like, because I think it's they don't want to admit that they need
Oh, I would admit in a heartbeat I needed it.
I've never had a problem with it. Like it never once phased me that I needed.
Yeah.
I'm like, oh, I don't
That's 'cause
feel
you
good,
work out all
and
the
now
time.
I do.
Yeah.
But a lot of guys have that, whether it's from a stigma or it's just the fact that it's hormone therapy that they're.
I have a theory about that.
What is it?
Okay, I'm older than both of you guys.
Are you?
I grew up in the generation with Arnold Schwarzenegger, Dolph Lundgren, Sylvester Stallone, right?
Who's my height, by the way.
We all wanted to look like those guys in the 80s, right? Now, I don't know what the younger generation, the guys they look up to, but a lot of them,
soy boys.
They're not action heroes. So that may be why there's an insecurity, because they don't have these guys, like I grew up reading the bodybuilding magazines and all the supplement ads. And I was like, man, I look like that. And so maybe it's a culture thing. Like maybe
it
guys.
Could be, but like I also think that, from what I see, it's just like I feel like crap. Everything in my life is kind of going downhill, and now you're saying I need
testosterone
therapy, right? Like hormone therapy. Nicole, do you see any of this out there? Do you get any feedback like that from clientele coming in?
Yeah, I definitely do. I see a couple different things. So I completely agree that sometimes men are shy to admit that they need something like TRT, or even that they need their hormones looked at. I don't know why, but when people think hormones, they think females, as if like men just don't have hormones, but that is not the case. So yeah, I think there's a big thing around that. Honestly, what I deal with probably the most is, especially with my athletes, that it's almost like they want to achieve results without any extra help. And receiving testosterone sometimes, I feel like, makes men feel like they're getting help when they shouldn't need it, which I really hate that that's the mentality that some people have, because you age, you get exposed to different things. We have this world around us that is really not conducive for health, and you're subject to that world. So I feel like there should be no shame. And, we all have different battles. We all have different things going on inside of our body that make things not work exactly the way that they should. And I think, especially with men, usually after like that first testosterone injection, they're like, wow, I was actually really, really, really missing this. And this is going to absolutely change my life. Yeah, it is that quick. It's that impactful. And the turnaround is that like amazing for them. And I get, it's not just athletes alone. Like I have so many clients of mine that are like stay-at-home dads. And I've had clients be like, listen, I have to take my kids to school in the morning and I am falling asleep behind the wheel. I can't stay awake during the day. My brain is just not functioning. And they're on testosterone for a week and they're like an entire new person. And so I completely agree that men are definitely more shy into seeking treatment. But I think once they allow, I usually try to phrase it like, listen, let's just do a little trial run, see what you think. No harm, no foul. You don't want to do it. You don't want to do it. Usually all they need is like a week of treatment. And they're like, oh yeah, I definitely need this to make my life so much better. Yeah.
Yeah. So let's talk about just kind of overall wellness, because beyond hormone therapy, obviously you've got a lot of letters behind your name. You talked a little bit about one thing impacts the other. You talked a little bit about orthopedics and that sort of thing. So why don't you just kind of give us a lay of the land on your thoughts about just general wellness, especially as it pertains to men's health?
Yeah. I think when I think general wellness, I mostly think about preventative and chronic disease, since that really is what gives us wellness. And I think there's a really big misconception out there about predispositions to wellness. And so genetics. Just because something runs in your family does not mean you're going to develop it. Your genetics absolutely do not define you. And I think we live in a conventional medicine world that has made us feel like, oh, every single person in my family, they died of colon cancer, so I'm just also going to die of colon cancer. And I love having the opportunity to speak on platforms like this, because it allows me to let a greater audience know that that is not the case. You have absolute control of your health if you take the time to make the necessary steps and get in control of it. You have all the power. Everybody does. If you are able to monitor your diet, 80-20, if you will. If you're able to keep yourself in the gym, if you're able to get good sleep at night and maintain strong, healthy relationships, I hear you guys laughing, which is so important for testosterone.
It is.
Yes, it is. Yes, it is.
It is.
But if you're able to keep up with those modifiable lifestyle factors in a positive way, your odds for developing chronic disease and your odds for maintaining generalized wellness will be so greatly improved. And I think in my field of work, I work in functional medicine. I'm a self-pay only provider. A lot of people get a little sticker shy when they see that, which is understandable. But I think probably the most shocking part of what I do is half the time the advice I'm giving is exactly what I just talked about. It's diet, sleep, relationships, lifestyle, and your ability to cope with stress. And if you can get on top of those things, your world will be entirely different without everything else that I do. Like just those modifiable lifestyle factors alone can be so changing in overall health. Yeah.
Yeah, we were laughing because sleep is
sleep's that's
definitely
yeah.
It's just what do you think? I mean, what's your dime store advice for the Neanderthals out here on managing sleep better?
Yeah, sleep is huge. So many of our bodily functions happen while we sleep. You need, you need at least 7 to 8 hours a night, which I know some people are going to laugh at this and be like, yeah, okay. Yeah. But it's true. When we sleep, we are, it's when our cholesterol breaks down. It's when our body has an ability to reset. It's when our hormones go through synthesis. It's when everything in our body has the opportunity to detoxify and recover. And so if you are not adequately letting that process happen, you're going to find yourself with a whole slew of chronic disease. And you really, especially men, there's multiple studies out there that if you get less than 6 hours of sleep at night, your testosterone will be depleted by somewhere around 20 to 40% on average. So even sleep alone is so important for our ability to produce hormones, as well as manage just the day-to-day things that we do. I think we've all been there when we haven't had enough sleep and we're like, oh yeah, I can tell. My husband can tell when I haven't had enough sleep. So I feel like it's pretty recognizable how important that it is. A really good book that you guys should consider if you haven't is Why We Sleep by Matthew Walker. It is absolutely eye-opening in the sense of how important sleep is to our overall health and wellness.
Okay, question. So if you're on testosterone, you're taking testosterone therapy, you're working out, you're eating pretty good diet, 80-20 rule. Can those sleep numbers fluctuate a little bit and say maybe instead of 7 to 8, maybe more like I get 6.5? Do I kind of make up for that with, I know what you're going to say, but I'm going to ask it, but can you kind of make up for that because you're on, I knew you were going to say that.
No. I love HRT. I love all the different supplements, but there is nothing that replaces the natural functions of the body, truthfully.
Yeah.
Arnold Schwarzenegger said to sleep faster.
Yeah.
He only sleeps 4 hours a night.
That's right.
He says sleep faster.
Well, what's interesting in that book that I referenced, they actually talk about how there's also a lot of studies that go to show that doing like 4 hours and 4 hours in some people is more beneficial than 8 hours as a whole. And it also talks about, you hear this all the time where you're like, you can change your sleep cycle. So like being like a night owl or an early bird, like you can change that. Actually, this book discusses how that's not the case. Whatever is innately in you is innately how your body should perform. So if you feel like you're someone who functions better when you stay up late and wake up late, or vice versa, go to bed early, wake up early, it's probably, there's a lot of truth to that because you're allowing your body to be in that natural rhythm versus like forcing something super unnatural to how you were like innately built.
That makes sense.
It does make sense. And the way I've always worked the best is if I'm up till midnight or 1 a.m. and then I'm up by 5 a.m, but I take a nap.
I see.
If I have it, but like that's just natural. Like even days off, it doesn't matter. That's kind of like how I function.
Yeah. It's just like your personal circadian rhythm.
Yeah.
Oh, I don't think naps are bad at all. I think depending on how frequently you feel like you need to take a nap can tell you some stuff about your overall health. Like if you're always waking up at a certain time in the morning, or if you're always needing to nap in the afternoon, you probably have some hormone dysfunction. But if it's just like an occasional, I'm a little extra tired today, like I don't see anything wrong with that.
So I had a doctor, I've had two different doctors. One of them said napping midday is great for you. It like helps kind of reset everything, heart. And then another doctor said it's terrible for your heart health. So I don't know. Yeah. Said it's, and I wonder if that's just because it's like a co-symptom of bigger problems going on that he was getting at.
Yeah, that's kind of what I was attesting to. I think probably the most common nap schedule I see is people feel the need to crash about 1 to 3 p.m. in the afternoon, which is definitely a sign of adrenal fatigue. So that's something that you always want to pay attention to. But, I am also a big advocate of like listening to your body. If it's happening day in and day out, like clockwork, there's an issue. But if it's just like an occasional, I feel like taking a nap, then I don't see anything wrong with that.
I know for me, like since I've started the TRT, because I get up really, really early. So I get up at 3:30. That's early. Monday through Friday, pretty much every week. And I go nonstop until I pick my son up from school around 4, hang out with him, and then he goes home. I'm usually pretty good, and I train around noon, 1 o'clock. So I work out for an hour, 5 days a week, 7 days in the weeks I don't have him. So the weekends are different, but anyways, I normally like at night, once I like lay down on the couch, say it's about 6:37, I'm done. Yeah. But when I get ready to go to bed, and I do the whole, I'll journal before bed sometimes, and I'll try to turn the phone off and the TV. And sometimes my mind just won't stop, or I'll fall right asleep. But then I'm waking up at like 1 o'clock. I'm like, all right, it's time to go to work. No, I still got 2.5 hours. Yeah. But I noticed a difference on the therapy, because I am able to kind of maintain that steady stream of energy, even if I didn't sleep 7 to 8 hours, which, I mean, to be perfectly honest, I don't sleep 8 hours a night because, I'd have to go to bed at 7:30. But, but I have noticed a difference with the therapy for sure, as far as energy levels go. But
absolutely. I feel like, sure. Yeah, a lot of people don't have the luxury.
I don't have the luxury. So.
That's fine. I also typically do not have the luxury of taking a nap, so I can appreciate that. But a lot of people get a little bit of that second wind at night. The thoughts running, it can be really, really debilitating for a lot of people. One of the things I like to recommend the most is listening, like putting your phone. So you can go to YouTube and do this, or I personally use the app called Headspace, but you can listen to either, what's the word I'm looking for? You can listen to frequencies. Matthew McConaughey. Yes, that was actually where my mind was going. But then I was like, oh, no, we should mention frequencies. So if you're not going to listen to Matthew McConaughey, you can consider listening to frequencies like delta waves or gamma waves. They really help to put the mind at ease. Or you could do something like white noise or green noise is really good for people with anxiety.
And I do have a noisemaker that I sleep with. So it does help kind of drown me out. So
yeah. Absolutely. Yeah, that's really good. And then you can always do like red light therapy at night. Red light is not only anti-inflammatory and boosts collagen, but it is super relaxing. It naturally depresses your cortisol, so it helps you relax when your cortisol is supposed to be lowering, so your melatonin is rising, and then you just go to sleep.
Nice.
So if you don't mind, can you enlighten us all on adrenal fatigue a little bit? And it doesn't have to be crazy, but just like, what does that even mean? And how does that impact guys, in the daily life?
Yeah. So adrenal fatigue. So our adrenals are glands that sit on top of our kidneys. And I like to describe our adrenals as a little bit of like a stress resiliency system. And so it's what allows our body to recover from stress. You have two main hormones that are related back to your adrenals. You have your DHEA, and then you have cortisol. Cortisol is really well known. That's our stress hormone. Cortisol should rise like 45 minutes to an hour after you wake up. That's when it should peak, and then it should slowly decline throughout the day. The cortisol hormone has an inverse relationship with melatonin. So that is what creates our sleep-wake cycle. Cortisol goes up, melatonin goes down, we feel awake. Cortisol goes down, melatonin goes up, we want to go to sleep. And so that's how it should work, but that's usually not how it works for most people. So most people do have some kind of cortisol abnormality. The other side of that, DHEA. DHEA is so important because it is a precursor to testosterone. And so if you're someone who has been through a lot of stress, chronic stress, you're someone who has experienced a lot of traumas, odds are you're going to have some abnormality in your DHEA levels. Typically they get low, which means your testosterone production also gets low. You had mentioned earlier, like, does stress play a role in testosterone production? Yes, absolutely. Because if you lose that ability to have stress resiliency, you lose DHEA, which means you lose your precursor to testosterone, which means your testosterone production literally cannot be as good because of the amount of stress that your body is undergoing.
That makes sense.
And that's what adrenal fatigue essentially is. And there's different stages. You can have mild, like moderate and severe essentially, and different stages depend on different treatments. But all in all, it is important to keep up with it. It's so important to learn how to cope with stress for your overall hormone production.
So speaking of stress, I want to kind of bring this up, and our big thing is talking about mental health and men's mental health awareness. And I was aware of I had a friend about 5 years ago that was on TRT through the VA as a treatment for PTSD. So we've kind of hit on, cortisol levels and testosterone. Can you kind of tie in your thoughts on how testosterone therapy might help someone with, childhood trauma or PTSD from combat or something like to that nature? Because it was very interesting to me that the VA would prescribe a drug like testosterone when it's still taboo in our society, because as an active duty member, a lot of times you couldn't be on testosterone unless you got, the proper authorization. Because we used to get when I was in the Navy, we would get drug tested for performance enhancement. Yeah, even the supplements we used, we had to have them all checked off by a corpsman. Wow. We couldn't even take ibuprofen. So it's interesting now that I think they did it by design, honestly. But it's interesting that now the VA is prescribing, testosterone, as a treatment for PTSD.
Yeah, absolutely. Honestly, I love to hear that. I typically don't hear people doing TRT for something like PTSD. So I'm really happy to hear that whoever prescribed that was on top of it. But when you get PTSD, cortisol levels bottom, and they stay that way. They stay super depressed for a long period of time. And that plays a hand, once again, with your DHEA levels. So getting prescribed TRT, once again, for those reasons, it's good because you are giving someone that immediate relief. So you get that immediate feel better, if you will. There's still definitely underlying work to be done when you're dealing with someone who has that past trauma. So it's essentially like you're treating the symptom a little bit with TRT, which I'm not opposed to, but I do still think there's definitely work to be done when you're dealing with people who have, adverse childhood events, or you have people who have PTSD. If you can take the time and effort to fix that foundational layer, the patient is all the better off. But I love, we kind of talked about it earlier, the seeing the results producing the motivation. That's a lot of what TRT does when you're treating someone who has like the ACE events or the PTSD, because they're going to start feeling better, and that motivates them to want to put it in the work to fix that foundational layer to help them perform even better in the future. But low cortisol levels is the primary reason that so many people have PTSD. So if you're able to kind of fix all those pieces together, then you're going to get all the better of outcome. So that's exciting to hear that they did that.
Yeah, it's really cool.
Yeah.
It is cool. One of the things I wanted to do is debunk some and demystify some of the common things that especially I hear all the time. What's the terrible side effects? You get cancers, you do all this stuff if you're on TRT treatment or hormone therapy in general. So I'd love to hear an actual professional talk, like an educated perspective on, because everything that you do does have some side effects. Yeah. But what I hear are so extreme and so off base that I'm like,
what are you hearing?
just that you get cancers, you're going to get gynecomastia,
Well,
you're going to get all these crazy things. And the reality is you can take anything to an extreme and get extreme symptoms.
This
but
is true.
I'd love to hear you touch on that.
Yeah, that's actually such a good question. So I think the first most important thing to talk about is the difference of hormones. You can have bioidentical hormones and you can have synthetic hormones. When you talk about testosterone, usually they are all bioidentical, but there's certainly some weird ones out there. Usually when it comes to the difference between bioidentical and synthetic, we're talking a little bit more women's hormones like your estrogen and your progesterone, but still important to be considered. And the reason I brought that up is because a lot of the research that you will see out there is synthetic hormone only derived. So it's really not even applicable to people who are using bioidentical hormone replacement therapy, which is what you should always do. The bioidentical hormones mimic the hormones in our body versus synthetic is literally just that. Our body doesn't recognize it as hormones, so it doesn't treat it as the same. So that's when you really start to see, especially in women, a lot of the increased cancer risks, blood clots, stroke, heart attack, all of those things. So that's one side of it. The other side of it is that with men especially, I feel like you can kind of get TRT from a lot of different places. So there's a lot of like pop-up TRT shops, if you will, that are very run-of-the-mill. Yeah, come in. We have this protocol. We'll just give it to you and you'll be fine, like all of this stuff. And they never check your labs. They never really talk to you about anything. They don't do any follow-up treatment. And the truth is the matter is HRT is very much not one size fits all. It is not black and white. It is an art. Everybody processes hormones differently, which means you have to treat every patient individually in that sense. And so a lot of the horror stories that you hear, especially with testosterone, if you let testosterone get way too high, it does increase your red blood cell production, which increases your ability to clot, which is when you start to see some of those really, really scary side effects. The other side of that is, like I just talked about, not everyone processes hormones the same. If both of you guys take testosterone, both of you will convert to estrogen in a different amount. We call this aromatization. Everyone aromatizes in a different form. And so if you're not watching somebody's hormones while they're on TRT, let's say you're a really high aromatizer, you're going to do a high conversion to estrogen, it very likely will end up with things like gynecomastia or back knee or mood lability or water retention is huge. And so I think the most important thing for patients to recognize is that if your provider is not routinely checking your labs, they have no idea what's going on in your body. We cannot look at you and be like, oh yeah, this is the right testosterone dose. Like, we don't know what's happening on the inside. Yeah, if I wish, because I would be like so wealthy if I could do that, but that is just not how it works. And so personally, I like to check labs 6 weeks after starting, and then at least every 3 months, assuming that things are going status quo and there's not a lot of other side effects going on. But I'm very much like, hey, if you feel like something's off, like something's not right, let's go ahead and check your hormones, because, you know, things can change, dosage can change, your needs can change. Everything, like I said, it works around each other. So if you make lifestyle changes at home, you may need a different dosage of testosterone. Things can really vary. And so it's important to really stay on top of like what's happening inside of the body so you can mitigate things when they possibly go awry.
So is the testosterone that you prescribe, is that synthetic or bioidentical?
Bioidentical, 100%.
Is it really? I didn't know that. I thought it was synthetic. Wow, I thought it was synthetic. Huh.
No.
Yeah.
I would treat you better than that. I wouldn't give you any synthetic stuff.
And this is why the confusion, because I've done pellet therapy in the past and I knew that was bioidentical, and I just assumed because of the injection it was synthetic. I didn't realize it was bioidentical also.
Oh yeah. Oh no. Yeah. And
interesting.
to even like touch a little bit on that, because I get this question all the time, pellets versus injections. Yeah, pellets. I'm actually not a big pellet advocate. I find that people who get pellets get like a drastic increase in hormone, and then it just nosedives, and then you feel like you don't have anything. Yeah, I like a twice a week injection for males with testosterone because it's the most naturally mimicking rhythm of what our hormones do inside of our body. Yeah.
Yeah. And one of the reasons I brought that up is because when guys talk about TRT, there's so many online services now for hormone therapy. And they basically just, I don't even know that they really talk to you about the therapy that you're getting. I think they send you a little blood test in the mail that's like a finger prick blood test, and then they just ship you whatever you want.
Yeah. It's super alarming. I'm like a part of a whole bunch of different Facebook pages, and I see women all the time that are like, yeah, I just went on this website and they told me they didn't even have to check my blood work because it's always going to be different and it doesn't really tell us anything. They just sent me hormones. And I'm like,
wow.
What? Like, how can you, I don't know, even from a patient perspective, I'm like, I would never want to be started on something that alters my entire chemistry without someone like looking at it first.
Mm-hmm.
I don't know. I would want to know, what's going on there. So,
yeah.
I had a client get growth hormone that way. Online without, like, through a doctor, but not even doing labs. It was a teledoc type thing, and she,
how much was it?
She screenshotted me the thing, and I said, "You're taking growth." Like, she didn't know that she was actually taking growth. But I said, "You're taking growth hormone." I was like, "We're gonna change your workouts. You're doing growth hormone." But it was like, wow,
I was like left over. Just let me know. But
no. But I was like, huh, that's interesting, because my generation, growth hormone, it was. Whoa, you don't touch it. Wow. It's Barry Bonds and Mark McGuire ruined that for the rest of us. Bless them.
Yeah. That's so intimidating. I can't believe that happened. That just, you just never know. You never know what's out there. And that's kind of, that can be a scary thing too. So.
Yeah. One of the things that I think, I want to touch on too, because there's a lot of younger guys, influencers on YouTube, especially like bodybuilder. Then they're young. They're in their like late teens, early 20s, and they're massive. And they're cranking out like, 3, 4, 500, blasting tests like crazy.
Well, they ain't using TRT, man.
They're just blasting tests though, and that's the thing. It's like it's a really popular and like
they're blasting more than that,
and they're super trend too. But testosterone therapy, when I say testosterone therapy, it's therapeutic.
Mm-hmm.
Can you touch on the abuse of testosterone and kind of some of the dangers involved in that? Especially, like I said, there's a lot of young guys that are heavily influenced by fitness and wellness gurus out there that really just don't know what they're doing.
Yeah, I've seen a lot of those guys, actually. I get people in their 20s all the time that thought it sounded trendy to start testosterone. Whether or not they needed it, I don't know, but they thought it sounded trendy. And so they started it, and they're taking this huge dose of testosterone, and they really just have no idea like what the repercussions can possibly be. First and foremost, if you're buying it online from like a random source, who even really knows what you're getting? You're maybe getting testosterone, you're maybe not. Like, there's really just no telling what's in that. So definitely always recommend getting testosterone through like an actual provider. But the other side of that is fertility is huge. I think a lot of men don't recognize that when you take testosterone, for like a period of time, that tells your body that you no longer have to make it. And so what I see probably most commonly is men in their 20s come in, they're already on testosterone. They want me to look at their labs. And I'm like, you're 22, you're 23. Do you want a family? And they're like, oh, of course. And I'm like, okay, well, you need to stop this like yesterday, because your body now for the rest of your life, which hopefully is long and lengthy, is going to say like, I don't actually have to do this. Like, I don't have to produce testosterone, which can be such an issue. And then I think the other side of things is definitely, we talked a little bit about it earlier, but uncontrolled testosterone changes a lot of stuff in your body. If it's super, super way too high, you can get that increased red blood cell production, which can leave you at increased risk for things like blood clots, heart attack, and stroke. It can increase the amount of bad cholesterol you produce and suppress your good cholesterol, leaving you at increased risk for cardiovascular disease. It can raise your liver enzymes. It can do all kinds of things for a lot of men. It messes with their cortisol. It messes with their thyroid. So it can definitely have a whole slew of repercussions. Not to mention if you're a high converter and you're carrying a super high load of estrogen as a man, that can also have a whole slew of repercussions that, men definitely don't generally want, things like your gynecomastia and the mood lability that we talked about earlier. You can get some permanent changes in those if it goes uncontrolled for too long.
Well, you also, neither one of you guys have mentioned it, but the hair loss factor.
Hair loss, yeah, that's another big one.
Yeah, whatever.
Yep.
That happened before you started therapy.
No, it didn't.
Did it?
No.
Nope.
I was on high dose pellets, and then I had some very traumatic, life-changing events.
That's what
at the tail end, and then it just went from I still have some hair, to now it's like goodbye. It's all here now. It's all on my face. Yeah. But yeah.
Yes. Yeah, no, you're spot on though. I didn't mention that, but yeah, you can also, especially if you're someone, not everyone converts, has as much DHT as another, but that is the number one cause of male pattern baldness. And certainly some people, when they get on testosterone, like that number can skyrocket and they'll start to see hair loss, or sometimes it messes with their thyroid and they'll get hair loss from that too. So definitely important to consider.
Like my thyroid numbers were horrible before I started TRT.
Interesting.
Horrible. And now they're normal.
Yeah. And that's what I was saying earlier. It's very much an art, like it's very much patient dependent. And as long as you're on like a good, well-controlled dose, it's going to be very beneficial for you. But if you're just like running rampant and nobody has any idea what's happening in your body, it can have significant repercussions in that sense. But as long as you're working with someone who's watching your hormones and monitoring them, then odds are it's going to have a very positive benefit on the body. It's just for those who don't necessarily take that path.
So let's hit on this real fast. So for the viewers out there, and also the listeners on Spotify, we're in Franklin, Tennessee. So we're in the Middle Tennessee, Nashville area. If we've got listeners that are hearing this podcast thinking, man, I really need to get my lab work done. I'm really more interested in hormones and talking about my supplementation. Where can they find you, Nicole, and where can they learn more about you?
Yeah, so I work in Franklin, Tennessee. I do offer telehealth to many states. So I'm not just specific. Oh, nice. Yeah. I'm not just specific to being in person. No, that's okay. Okay. But I work at Invigorate Health. And like I said, we are in Franklin, Tennessee. I do offer telehealth. I also have social media. So I have an Instagram, Nicole Stroopnp. I have a lot of patients reach out to me on there. I do provide like a lot of helpful tips and tricks and things that you can do to help maintain your health or monitor your health. General things you can ask for if maybe you don't want to be a client of mine, but you just want to know more about general functional medicine and regenerative therapies. I post a ton on there. So that's definitely between that and then contacting the clinic, Invigorate Health. One of those two ways is definitely the way that you can reach me, become a patient of mine, or certainly just pick my brain and see if we're even a right fit to be working together.
Nice. And we'll make sure to include that with the episode, how people can reach out to you with the contact info.
Oh, yeah. Yeah, that's important.
Go ahead. Yeah. Well, and just for our listeners, I'm actually one of Nicole's patients. Yeah. So I've been seeing her for probably almost a year now, I think. It's been.
Yeah, I think it's been about a year.
Yeah. Yeah. So, and I've seen great results and very happy with, especially the feedback that I get from you, because I can ask you specific questions and kind of understand more about hormone levels, and we've made some changes to some of the stuff I'm doing, goals that I have. And so I'm a big goal setter, and I like to kind of push the envelope in certain areas. So it's nice to be able to pick your brain. I trust you. I know you're very knowledgeable, especially with that background in fitness, competitions, and kind of, come up with new ways to challenge myself, but in a way I'm 45, so I still have to do it in a way that's safe and healthy, not going kind of like you're talking about the influencers at 22, just jamming trend and everything else. So
yeah, it's definitely see that for sure. So, but it's
I'd be much bigger if I was on trend.
But we all would. Yeah.
That's fair. That's a fair statement. Yeah.
I do want to hear your thoughts on peptides. There's it's a kind of a buzzword, and I know with Robert Kennedy, he's been talking about it for the last couple of years, and now it's kind of really ramping up in his conversations. What are your thoughts on peptides and their use?
I love peptides. I am certified in peptide therapy. I think a lot of people don't know what peptides are. They're just amino acids that naturally exist in our body. They are signaling molecules. So you can use them very specifically to target a very specific outcome. And so you can use them for things like chronic musculoskeletal injuries or wound healing. You can use them for like a hair, skin, and nails aspect, collagen production. There's growth hormone secretagogues. I'm not a huge HGH person, but I love some growth hormone secretagogues, especially as an anti-aging regimen. I mean, opportunities are endless with peptides, and I'm super excited with him being in office and the hopeful accessibility for peptides across the board. I also want to make sure that listeners know, please do not buy peptides online. Y'all, there is no regulation. There is no telling what you're getting. You need to get them from a trusted provider, from a compound pharmacy who makes peptides and is regulated. That is so important.
And also, don't eat Ben and Jerry's every night if you're running IGF-1.
Yes. We definitely.
Just to be clear, peptide.
IGF-1. Yeah, we definitely, Steve and I, we had that conversation where he was like, I think my blood sugar is dropping, but I am eating Ben and Jerry's at night. And I was like, that checks out. Man.
I'm glad that you mentioned the online sources, because you can go online right now and they'll sell them to you. And it says real big, for experimental purposes only. Yeah. And dude, I'll experiment all day with HGH. Right? It's just not smart.
No, it's
just not smart. So like if there's any way you can reinforce, talk to a physician, talk to somebody.
It's not worth the risk, man. I mean, it's just not.
It's just not.
Completely.
One of the things that's really scary to me about the online, especially online peptides, are the effects that it has on your insulin production and insulin regulation. Do you mind touching on that when you come back on screen? What happened to you? I'm glad it's her and not us this time.
You want to just stop it and then re-record when she comes back on? Or you want to let this keep going? What's easier?
Yeah, it's easier if I just cut this instead of
Gotcha.
Trying to splice two videos together. Wow.
Uh-oh.
Fuck.
Well, we got a lot.
We got a whole lot.
Yeah, we did. Oh, she's coming right back.
That looks fucking fantastic.
Yeah, it does look good, yeah.
Like really good.
Dude, we can't carry the microphone now.
Yeah, I need a different cord. So this one, it's just that. Oops, let's turn that off. That
is that battery powered?
It's got a small battery pack in it, so it can be independent. But it's the USB-C.
So I guess there's not a Bluetooth on it. We can't just use it.
No, but I can plug the USB-C into here,
gotcha.
and then run it as an external microphone.
Nice.
So then we can just
put it right
mount it up right here. The little thing. We got your back.
She is.
Okay, I'm so sorry. I don't know.
It's okay. We can edit that part out.
No worries.
Okay, perfect.
So I will segue back into that. Just talking about what were we talking about?
We talking about insulin.
Yes. So peptides, and in particular the HGH, insulin, yada yada.
Mm-hmm. Yes. What was the question?
I don't know.
Well, you were
the
saying.
The question is, what was the question?
The dangers of you running.
Yeah. So running these online peptides, and in particular, I see it a lot with the insulin-like whatever factors, IGF.
Yeah.
They've got the IGF-1 that's like for experimental use. Mm-hmm. But I want to talk about a little bit, like, especially if you're not being monitored, if you're buying this stuff offline, you don't know what it is. What effect can that have on your actual insulin production and your insulin, like, levels throughout the day and night.
Yeah, absolutely. I mean, it can definitely raise them. It can definitely have some negative repercussions. I think the other thing about using something like IGF-1 that might even be like my bigger fear outside of insulin is if you have way too much growth factor, you will literally grow. People who have growth hormone abnormalities, like from birth, those are we call that like acromegaly, people who are literally large, like all over, just very large people. That can happen if you let your growth factor go way too high for way too long. You can develop that, which is actually why I'm not as much of a fan of true HGH, is because it's less controllable in that sense, and there's more control in using something like a growth hormone secretagogue, because you are able to, it's not quite as impactful, but that's a beneficial thing because you're able to tier the dose a little bit more to your patient without having to worry so much about that negative repercussion. But you'll definitely see some abnormalities in blood sugar with the IGF peptides. Everything from feeling hypoglycemic, so getting drops in blood sugar, to some people are much more prone to getting elevated blood sugar, so getting like insulin resistance from it almost.
Yeah.
And vertigo.
And vertigo.
Yep. Yes. Hence the blood sugar drop from the Ben and Jerry's. So
I've got to be super cautious myself. I've always been hypoglycemic.
Oh, that's right.
My entire life I've been hypoglycemic. And so I've always had to watch it ever since I was a kid. But I didn't realize when I started a fitness journey that before even beginning, hormone therapies, supplements.
Oh yeah.
Just spike your insulin and blood sugar like crazy. And so, it's an interesting thing to think about. And it's something that I always get a little nervous about. Like, what's this going to do to my glucose?
Yeah. I mean, the nervousness is, I think, a healthy thing. I think it's healthy to be aware and to ask questions. I feel like there's too many people who are just like, oh yeah, I'll try whatever. And they don't even understand, everything has a repercussion on the body. The question is just, what is it? And so I think it's definitely powerful. Knowledge is power in that sense.
Oh yeah, big time. Do your research, be smart.
Do your research.
Go to a professional. And I know we say this a lot on this podcast, especially, is like, get your blood work done. Talk to a professional who actually knows what they're doing. I say this in jest, but I think it's kind of true. Like, guys are kind of dumb. And so it's like somebody that you trust is like, hey, bro, we should get on trend. And you're like, yeah, we should get on trend. Let's do it. Same thing happens like all the time, but you hear these horror stories and it comes out like more and more and more, especially these influencers that buy this crap online.
The good thing is, though, like, our target audience is the 40 to 50 range.
Yeah.
So I think most men in their 40s to 50s are probably going to hopefully make better decisions and approach it in a way that's safer and not,
I would hope so,
not buying gear off the internet, or
it's just available, dude. It's like you Google, like I want to, increase muscle mass. The first thing that comes up is an ad for, experiment.
But like Nicole said, a lot of that stuff's it's not even what you're just buying oil, or you're just
synthol.
Synthol. But you don't even know what's in the product, so you don't even know what you're paying for.
Yeah, exactly.
That's black market stuff. You don't know what's in there. So, or it could be
you have
down.
no idea. Right. It could be watered down. That's honestly, in my opinion, like the best case result is it just being watered down. Like we could be getting something that's like never been used on humans before. Like there's no telling what kind of repercussions you'll have. Like there's just no telling. And it is like, I don't know. I'm just not someone to be quite so adventurous with what I'm putting in my body, but certainly some people are. So.
Yeah. So what's your overall message, Nicole, for let's say men's wellness? Like, obviously the lab work is very important. Monitoring your hormones, your diet, getting plenty of sleep, getting physical activity. Do you kind of have a summary of what men in general should be doing to focus on their health, or how why should that be important to them?
Yeah. I guess as an overall summary, you nailed it a little bit. Not even just like hormone related, but getting your labs done on an annual basis, like kind of a little bit far beyond a physical, because I feel like what they offer at the PCP office in terms of a physical isn't very all inclusive, if you will. And so I think getting like a comprehensive lab panel done annually is so important. That way you can see what is developing before it even develops. Like that's one of the best places you can be in. It allows you to keep track of things like your hormones. So not being afraid to talk about your health, I feel like is very, very important. Managing your hormones now can only set you up for success in the future. One of the most common disease developments that you will see with low testosterone is Alzheimer's disease. Once again, going back to that.
Really?
Yeah, it's huge. The research on low testosterone and Alzheimer's is like breathtaking. And it's so scary. And this really goes back into what we were talking about before, in the sense that we do nickname Alzheimer's as type 3 diabetes because it does have such a role with insulin resistance. But furthermore, it plays such an important role with testosterone. And we talked a lot about it, so I don't need to go back over it. But paying attention to your diet, like you said, exercise, sleep, taking care of your overall health. I feel like the other big part of it is stress reduction. We talked a lot about that. I feel like things like meditation and yoga and going on walks. Yeah. Everyone kind of like laughs at that a little bit, which I get it because I used to be in the same boat, but like that is so important. That is so important to stress reduction. So I just want to encourage like all of the listeners out there. There is no shame in taking care of your mental health. There is none at all. And taking care of your mental health and your hormones now is going to set you up for such a successful and positive future. So.
I think the overall
also,
thing,
go ahead.
No,
I was just gonna say this occurred to me like at the very end, but muscle mass, the biggest cause of death is low muscle mass, especially as you age. Like your ability to fight chronic disease and your ability to stay well has so much to do with the amount of muscle mass that you have. Keeping up your hormone levels and staying active plays such a big role in that. Plays such a big role in decreasing mortality.
I had no idea.
Dr. Gabrielle Lyons has the best saying, and she says, "We are not an over-fat country. We're an under-muscled country."
Oh, man.
I love that.
T-shirt, dude.
Yeah, she's amazing.
Yeah.
But one thing that stands out to me the most, Nicole, in your summary is you have to ask for help.
Yep.
And guys don't like to ask for help. So whether it's your mental well-being, your physical health, all of it. You've got to have the courage. So seek a professional who's more than qualified, that knows what they're talking about, like Nicole.
Utilize a trainer to help you get on your fitness journey.
And a chef who can make healthy meals that include a lot of green beans that you should eat.
That you should eat, yes.
That's right. I'll do a better job.
No, that's awesome. It's really cool.
Yeah, I think it's great. You can always sub it with broccoli or something. That'll lower your estrogen.
I'll eat broccoli.
There you go.
You didn't give me that option. I'd eat broccoli.
Start putting soybeans in
Ugh.
Look at that.
We don't have to run more tests to counter the estrogen.
Exactly.
Yes, exactly.
Awesome. Nicole, thank you so much.
Yeah, thank you so much.
Oh, thank y'all.
Yeah.
Smart.
Well, and I think it's really cool to bring you on the show because it kind of brings in a whole new area for men and kind of give men another approach to look at, okay, this wellness is more than just what maybe people think, like I just got to go to the gym and work out. Well, there's a lot of moving parts with that wellness journey. So I really thank you for taking the time out. I know you've been super busy these last several weeks, and it means a lot to us to come on to our show and kind of enlighten both of us and also our audience. And our podcast is growing, and we're in four countries now outside of the U.S.
Wow.
So we're reaching bigger audiences. So we're trying to really kind of carry the flag right now for men's mental health awareness. And I know that this all pertains to it in a big way. So.
1,000%.
Yeah.
It absolutely does. I love that. I am so appreciative of you guys having me on today. I love that I could hopefully provide some insight and some hope to your listeners, and to make sure that they know, like, yeah, you said it. There's no shame in asking for help. In fact, it can only benefit you in the future. And so the sooner you're able to take action and kind of get on top of your health, the better you're going to be set up for longevity. So
Well said. Yeah, I love it.